Hello, my name is Enos and welcome back to my channel. This is Work and Wonder. If this is your first time, please make sure you subscribe to the channel and turn on the notification bell, and anytime I upload the video, you will be notified and you will come straight here and take a look at whatever video that I have uploaded. I talk a lot about the mental health nursing Osce in the UK, and today I'm going to continue with that. But first of all, thank you all for making us get to 1K subscribers. I'm very much happy, as you can see from my facial expression, and I'm very much appreciative to all of you for subscribing to the channel and sharing to other people so that they can also have a look at that. So today we'll be looking at professional values. Professional values. A lot of people have been requesting that I do a video on the professional values because they feel that it's kind of a lot of topics to go through all of them, and then they are finding difficulty in in reading it, and of course in getting ready for their mental health OSCE exams. First, I must say that the professional values and the evidence base remains the same whether you are doing adult nursing or you are doing mental health or learning disability. So if you're an adult nurse and you are watching this video, it can also be very, very helpful for you. So without wasting much time, let's just go straight into it. So the whole professional values is based on the fact that as nurses, we have our own judgment, and when you are making a judgment on a certain scene or whatever has happened, you have to take into consideration the values that is expected of you per the NMC or the UK NMC. So there is a code of ethics that we must abide by anytime we are confronted with any of these issues. So that is the whole basis of this particular professional value. So here they give you a scenario, and either your colleague is the victim or the patient is the victim, and most of the time you are a witness or you witnessed it or you are put in that position to act. So in that way, how are you going to act? In your attempt to act to that particular problem or whatever situation that you are faced with, you must take into consideration the code of ethics. So before the November 2022, there were just 5 topics, all right: confidentiality, drug error, possible abuse, professional confrontation, and then social media. These were just the 5. But after the 14th of November 2022, they added more to it. They added about 10 of them to these particular 5, and then making it 15. So you now have 15 topics to read through, and the good thing is that there is a marking criteria for all these 15 topics. So make sure that you have a read at the marking criteria, and then when you get to the exam, so you would be able to answer your questions. So today we'll be looking at one of them, which is social media. Social media used to be part of the initial 5 that people were examining on from 13th of November upwards. It just used to be 5, and social media used to be part of them. So with social media, it's just based on the fact that somebody posted a patient or posted something from the hospital or wherever setting it is that the person was not supposed to post, and the person has posted it and you have seen it. So what will be your reaction towards it? In most of the time, the scenario is going to be that your colleague nurse posted a patient on social media and captioned it, talked about his diagnosis or his symptoms, or disclosed some form of information about the patient that he or she is not supposed to do so per the code of ethics. So when you go to the NMC website, there is a whole code revolving around social media, how nurses in the UK should use social media. So please, if you've not seen it, go there and go and read before you make any inappropriate posting on social media with regards to your patient. So I'm just going to pull up the scenario, and then we are going to read it, and then we'll look at how we'll be able to answer it. So as you are seeing on your screen, your nursing colleague Kofi likes posting a lot on social media. You are a friend with Kofi, and you come across a post he made sharing a picture of one of his patients on Facebook, captioning it with patient diagnosis and circumstance. So yes, your colleague, probably you work in the same ward, he's posted this on social media with a picture of the patient and then the diagnosis. This is very, very, very inappropriate, and you are not supposed to do it. This per the code that is stipulated in the NMC, code of ethics. So if you see this, what are you supposed to do? So a scenario like this can be given to you in the exam situation, and then they give you an answer sheet where you have to write your answer within a period of 10 minutes. So if you are confronted with a situation like this, how are you going to write your answers? So now, there are some few tips that I need to give you that will be very, very, very helpful. I've categorized this into about 4. The first thing you need to do is to acknowledge. Then the second thing is to recognize. Then the third thing is to inform or you report. And then the last one, of course, is to document. So first of all, you must acknowledge that there is some form of a problem, or you must acknowledge that situation. After acknowledging the situation, then you have to recognize that you would have to respond to that. All right, you acknowledge that there is a problem. The second thing is now you're now going to recognize that you need to do something. All right, you need to do something. Then the third one is either report or inform. So most of the time you need to report it to a senior colleague or your manager, or you need to even report it to the NMC, because this is a matter of patient safety, patient security, patient safety. So you recognize that you need to inform or you need to report to your manager or even the NMC. It is your duty of conduct to do that. If you fail to do that, then it puts your practice into question. Then, of course, the last one will be that you will need to document. You will need to document. Most of the times in these situations, you need to put together an incident report, and then you will need to be very specific in the incident report, who you reported it to, what happened, and then what is being done about their situation. So these are the 4 main things that mostly you need to do with regards to the professional value. So let's look at the sample answer for this particular scenario that I've brought up. So first of all, I understand that sharing confidential information, posting pictures of patients or people receiving care without their consent is inappropriate. So you have acknowledged that this is inappropriate. So that is the acknowledged bit of this particular, this whole the answer that you are giving. This is the acknowledged bit of it. Now you have to recognize that you have to do something. So it is my professional duty to report any concerns which has risks to harm the safety of my patient or the public, and failure to report the concern will bring my fitness to practice into question and place my registration at risk. So here you have recognized that you will need to do something. So you will need to do what? It is your professional duty to report this, because this is clearly a patient safety issue. It's not about you giving the wrong injection or directly doing something to the patient. That is only a patient safety issue. Posting a picture of the patient can also be a serious patient safety issue. Now the third point is that I will not share or comment on the post, as this may imply endorsement or support of the point of view. So clearly, if you go under it and then you go and share or you comment, what it means is that you are endorsing what your colleague is doing. So you don't need to do that. Then I will raise concern with ward manager at the most reasonable opportunity, verbally or in writing. So this is the report or the inform bit of it. You will need to report this to your manager at the least appropriate time or the least opportunity that you get. You have to do, or you have to report it to your manager. And then I will complete an incident report recording event, the step taken to deal with the matter, including the date and whom the concern was raised with. So I said it here, you will need to document. Here in the nursing practice, if it is not documented, then it is not done. So if you report and do all this and then you do not put in a documentation to back this up, then there is no paper trail or there is no form of evidence to suggest that you actually did it. So you need to put in an incident report, and you need to be very accurate when putting in the incident report. And then, of course, the last one, which is I will acknowledge the need to uphold the standard and value set out in the NMC code. And then, of course, the last one is going to be unique to acknowledge the need to uphold the standard and value set out in the NMC code. So in your attempt to report, in your attempt to document, in your attempt to inform, in your attempt to recognize, you will need to acknowledge and uphold. You don't also have to do anything that doesn't fall within the values that is stipulated in the nursing practice in the UK. So you have to be very, very, very professional when you are doing all of this. And that is pretty much it. It's not much of the professional values is not difficult. So far as you know your marking criteria, these are all in the marking criteria. All you need to do is to personalize it. And of course, if you follow these 4 steps, which is of acknowledging, of recognizing, of reporting, and of documenting, it makes it very, very, very simple for you to be able to write out your answers. So that is pretty much it about social media when it comes to the professional values, and you need to complete all this within 10 minutes. Yes, that is pretty much about it. And yes, the next time I'll come your way with another topic, and then we'll look at the scenario and also look at a sample answer that we can write for it. If you've not subscribed to the channel, please make sure you subscribe to the channel and turn on the notification bell. And again, if you are looking for the template for the care plan that I did, the link is below there. Just click on the link. It will send you somewhere where you can, have access to that. Again, I'm also conducting a research on the experiences and perception of internationally recruited nurses across the various NHS trusts in the UK. So your experiences and perceptions, please. There's also a link down there of a questionnaire. Please click on the link and make sure you fill in the questionnaire for me so that I'll be able to write these thesis out, and then I'll publish it. And then whatever the outcome is, I'll share them with you so that we know the experiences and then the perceptions of we international recruited nurses that are working across the various NHS trusts. So please make sure you fill in my questionnaire for me. And of course, also click on the link if you want to have access to the care plan that I have, the template of the care plan that I have crafted. It comes with some scenarios from assessment, planning, and then implementation as well. So it's a full package that I'm giving it to you. Just click on the link below and then you are going to have access to it. Until I see you in my next video with another topic under professional values, it is a bye for now. This is Work and Wonder, and my name is Enos. Bye.